Hello,
Yes,
and welcome to our speaker series, Experts Matter, hosted by XpertOnline. I'm Ghazala Amin. I'm the founder of GizBo Private Limited, the sole global distributor of XpertOnline. The topic for discussion is the future of dentistry and COVID-19 and an international perspective. And our speakers today are Dr. Subir Banerji from London, UK, and Dr. Shilpa Endla from Bangalore, India. I'm happy that quite a few people have joined in from India and I think also from the UK, and we look forward to some people, especially dentists, joining in from Malaysia also. So a very warm welcome to all of you. For some of you who might not know about XpertOnline, it is a web-based app, a very comprehensive, personalized virtual clinic for health practitioners, which is very confidential and secure. And now I would move on to introduce our speakers for today. Let me introduce to you Dr. Subir Banerji. He is BDS from Newcastle upon Tyne University, UK, and has been in dentistry and dental practice for over 35 years in London, a private referral and family-based practice. He has been in the same practice ever since he qualified and has long-standing patients, staff, and referrals. He has special interest in implants, restorative, prosthodontics, and aesthetic dentistry. He's also involved in teaching in King's College, London, and also in research. So a warm welcome to you, Dr. Subir Banerji.
and thank you.
Yeah, welcome. We also have with us Dr. Shilpa Endla, who is a dental consultant with an experience of 15 years, having been trained in UK with foundation training from East of England Deanery and masters in aesthetic dentistry from King's College, London. She takes pride in her work and particularly enjoys cosmetic dentistry. At present, she's engaged in private practice in Whitefield, Bangalore. Welcome, Dr. Shilpa Endla. And what is really interesting is that Dr. Shilpa has been a student of Dr. Subir Banerji. So that is something very nice to know. And
very proudly so, yeah.
And I suppose quite a few people who have joined in might be looking at Dr. Subir Banerji's face and wondering, you know, that they have seen him. This is a very familiar face, and sometimes it can get really irritating if you can't put your finger to it. So on it. So I would like to tell our viewers that yes, you're right. This is a familiar face. This is the face we've been seeing in the newspapers, television screens, and popping up on billboards. He's the one, Dr. Subir Banerji, who talks about the sensitivity of teeth and gums. So he's our very own Dr. Subir Banerji.
So thank you for pointing that out, Ghazala. my instance of fame.
Well, to get down to the topic for today, you know, COVID-19 seems to have turned our worlds upside down. You know, it has impacted all of us personally as well as our careers, professions. But I think it has really impacted the dental practice pretty badly, also because of the high risk of cross-infection as such. So, Dr. Subir Banerji, you know, what do you feel are the general implications of COVID-19 on dental practice? So what did you experience when the lockdown happened and the subsequent reopening? What has been your experience in UK?
First of all, thank you very much for the invitation and your very kind introduction. It's indeed a pleasure to be here and to be part of this. And yes, indeed, COVID, hasn't it just affected us all? And I know our specific area of discussion today is dentistry, and this has had a quite a marked effect. To use a well-used term, I think it's kind of unprecedented. It's something that we did not anticipate. And with this particular scenario, it has actually made us revisit a lot of what we do, as well as, you know, reconsider, of course, and sort of reevaluate. The main impact, in my view, has been from I have to say, from a business point of view, where initially there was, especially I'm of course coming from the standpoint of the UK, because the practice scenario is quite different. And for those of you who are familiar with the UK, you'll know there's a corporate sector, there's of course the hospital sector, there's a national health sector, and then there's a private sector. My personal practice is in the private sector. And as far as the private dentistry was concerned, that was quite markedly affected ever since we had the lockdown in beginning of March. And there was, in my view, not very clear guidance. It was a kind of a blanket lockdown. There was a lot of uncertainty as to what was going to happen, what we were able to do. But one thing was for sure, that we had to stop actually our dental practices. The concern was that in dentistry particularly, there was this worry about aerosol generation and therefore the virus being spread. And of course, there's been a lot of research since then about that but that was the initial thing. And I have to say that was quite a revelation, and the main impact being on business. On the other hand, however, we've always been confident in dentistry of how we tackle cross-infection. Our industry, if I may say, call it that, has been in the forefront of cross-infection control, and it has very, very high standards. So we were also, as a profession, very confident that we would be able to deal with this scenario effectively in the interest of our patients and keep a very safe environment. So we do have some experience in it, but of course, initially there was this uncertainty as to how to manage it, which is gradually clearing up at the moment. And I'm sure, it'll be good to actually see what Dr. Shilpa Endla says as well regarding this. But that was the experience. Initially, it was a hit to the business, particularly in the private sector. The national health sector, however, was still continuing on an emergency basis, as well as the finance structure of the national health system is slightly different. So dentists themselves were not immediately financially impacted as much as in private dentistry.
Mm-hmm. And what has your experience been, Dr. Shilpa, in India?
I think I totally agree with Dr. Banerji on this as to how this has affected all of us, no matter where we are in the world. Mm-hmm. Obviously, life has changed across all sectors, industries, and dentistry is no exception. So along with the pandemic came the uncertainty, the confusion, and there was a deep concern for everything we were doing. And generally speaking, the idea was to just keep healthy, keep safe, and to keep alive. Awareness in the profession on this matter was relatively low. No, none of us knew about this thing called the coronavirus, and I don't think we've had enough time or chance to think through our workflow through this before the pandemic forced us all to shut down our practices. In regards to how we run the practices now, I believe this pandemic has definitely changed views on being self-employed, on whether one should be self-employed or not, unfortunately. So that's definitely something that's the pandemic's definitely implied.
And because of all this, has the patient communication and patient management also changed, Dr. Subir?
Very much so. Incidentally, I'm very I'll be very honored if you could call me Subir. I can. So I think yes, it has. I think initially patient communication was very difficult because, of course, there was an uncertainty in the profession, as well as in the patients, as well as to knowing what was going to happen. And indeed, in the UK particularly, we were finding that, of course, when you're having a dental emergency, the situation would be, where do you go? Who can you see for an emergency? How safe will it be, etc. And these were so the concerns. And so from a practice point of view, my initial response was to actually contact all my patients on a level of reassurance to say that I was around, I was available, and that please do, your first point of contact will be myself, and that assurance was needed for the patients in my practice, and I'm totally looking from my practice point of view, and be able to say to them that it is that I was still around, that I was at the other end the call. And as you know, I've as well as the initial email contact and the telephone contact. I did go on to the online contact as well, with the XpertOnline, and in my version, the XpertOnline Pro, whereby I was able to maintain a level of confidential contact with my patients, and to give them that reassurance that, you know, that although it's different now, they used to be able to just come into my practice and see me if they had a problem, that I was still there to advise. And the advice from our government at the time and our legislative bodies was that we were able to do a lot of online prescriptions. And as you know, I hope Shilpa, if I could call you Shilpa, please, is that you will agree, is that, you know, when you're prescribing online, there is a little bit of worry as to, you know, if you're just doing it blindly. You know, it's very nice to actually see some records, to see any reports or the patients themselves, and be able, in a confidential manner, to be able to prescribe confidently. So initially that was there, but luckily through technology, it was maintained. You know, the communication, which was paramount for patient assurance, was maintained from my point of view.
Yeah, and your experience would have been similar.
Yes, I would only be echoing what Dr. Banerji said when I say, you know, during the lockdown, we had an obligation to be available to our patients via phone or email or through a video call. You know, we are supposed to stay in touch with patients because they are all the more confused they're all the more uncertain about what's going on. And my goal during this temporary closure of my practice was mainly to stay in touch with my patients and also to prepare my practice for a safe reopening at the right time. And I could say that most patients were understanding throughout those difficult circumstances, and they were happy to defer their appointments, and they were happy to just get a prescription in case there was an emergency. And yes, and most of this happened over this online web portal that I used, XpertOnline, and it was definitely secure to do this because this formed part of their clinical records. So when I look back at those notes, I'm able to, you know, keep up with what's happened with them then, and then I'm able to, you know, help them out. Now that the practice is open, I'm able to call them back and help them with whatever problem they've had before. So yes, patient management did.
Shilpa, what about the patient screening protocol? Were you given any directive about that, or you were able to, you know, follow your own judgment and do that?
It was from my point of view, it was a combination of both. We had some guidance, but there was a lot of, initially at least, a lot of confusion or indecision perhaps as to what constituted a definite system for COVID and what didn't, and when we would actually have. And then of course there was a build-up of the testing mechanism that they had in the UK. Just very briefly, coming back to the business point of view, in the UK at least, we did have a bit of support from the government, which allows what's known as a furlough scheme, which allows you to be able to keep your staff employed, as it was very important, because my staff have been long-term, employed, and their salaries, about 80% of their salary was paid by the government. And this system is going to continue until October, end of October. So a few of my staff who are furloughed, they have the security of the job to come back to later, but also have this financial security, which was quite important, I felt, from the UK perspective. But the screening process of patients, coming back to you mentioning about patient management, is that part of the process of communicating with the patients was to actually also secure myself and my staff, as well as assuring them that we were taking the adequate precautions to protect them when they came to the practice. So this was also important to actually establish with that. And so there was a lot of communication that was taking place initially to establish this.
I remember, Dr. Shilpa, you had mentioned that initially you were not seeing many patients in your clinic, and you were only seeing people whom you knew, whom you knew personally, and you knew that they would be very careful and observing all the safety instructions.
Yeah. So initially, we've never been through something like this before. So obviously there's a lot of apprehension, a lot of confusion as to how to go about, practicing like how we used to do before. But I suppose we all started with a new view on dentistry when we reopened. We now follow a stricter pathway with, say, like things like triaging over the phone. We carefully plan the patient's clinical need before delivering the treatment in practice, which we never did before. We would just have, patients who would just walk in to have treatment done, or patients who probably would book appointments and not turn up at the practice and such. But now we don't have such a thing happening. All patients are seen by an appointment basis only, which is kind of not the usual practice in India, I would say. So yeah, this was one thing. And I'm not aware of any financial help that was available through any of the government support schemes for any of the dentists. So majority of the profession in India
have not been told about any support or any kind of financial assistance, is it?
Majority, sorry, yeah.
Like Subir was saying, talking about UK. We didn't have anything like that here?
I don't think we have anything. At least I'm not aware of any financial help which is available through government schemes as such, because the majority of the profession in India is entirely dependent on self-funding. So business did suffer drastically during the lockdown. In 3 months of lockdown period, I've had to furlough my assistant, but I had to keep paying her because this was her only source of income. Yeah, so she was laid off work temporarily, but then I did pay her for a couple of months, definitely. So yeah, I was hanging in there, but yeah.
It's very nice of you, but many of what I have heard about other practices where there was a number of staff, they had to let them go. So in this kind of situation, especially if you look at the young graduates and those who have done a master's in dentistry, they are really apprehensive, because what do you think would be the prospect right now for hiring new people at all?
I don't know
from
if
my perspective.
Yeah.
Sorry, Shilpa. Shilpa, you first. Yeah.
Yeah, I don't have much to say in this because I'm a small-time dentist around here, so I pretty much manage things on my own. So I've not had the need to employ an associate. So, and I don't see the need as of now for myself. So I don't think I have much to say in this, but I can't speak for those who are unemployed right now. I can see this not working out for me, who's been in practice for a good 15 years. And I don't know what kind of situation they might be in. So.
From my perspective, I think Shilpa is being very modest here when she says that she's just a small practice. I've been to her practice; it's absolutely fantastic. So you're being very modest there. But from here, I think the very similar feelings. I'm involved a little bit in training dentists as well, and there is this worry about clinical training. But what's interesting, of course, that there has been a little bit of a shift, because particularly newer graduates, I find, and as I was mentioning before, I think the version I have on my that I use is the XpertOnline Pro app that I use, where there is a sort of essentially a mentoring service that takes place. Where one of the things that new graduates always need is a little bit of mentorship. And of course, if you're at a clinic where you are with your mentor, then it's easy because you're actually you're able to communicate with them directly. But of course, now with this scenario, you still have a need to be in connect with your mentor and mentees. And I think that this has started to happen online now, more, and that's what I find it useful for. Because essentially, my feeling was that with the telephone and other modes of communication, it's okay for administrative backup, administrative communication, but it's very difficult to have a clinical communication with both mentees as well as patients, and this is where we had to adapt and in this way.
Yeah, and when you are delivering, your the care to your patients, as dentists, and because of the present situation and high risk involved, do you feel very apprehensive, uncertain? There is a degree of nervousness while you are in the clinic treating a patient?
For me, initially there was. Initially, I was very uncertain what was required of me in terms of protection, PPE, protecting my staff, protecting my patients. There was uncertainty because unfortunately in the UK, and if I've been be forgiven by the authorities for saying so, but there wasn't clear guidance. And I can understand that perhaps there was a lot of unknowing there as well. So a lot was put on the practitioner themselves to work it out. And from my perspective, it was a matter of looking through the research both in the UK and around the world to see what the approach was around the world. And it's been very varied. You know, the advice on PPE has been very varied across the world. The advice on how to manage patients, what to do and not to do, has also been varied. So, but as professionals, as we have been specifically trained to manage this during our trainings, it was something that we had to take on board, and we still are. And I have to say now, after we've been open now for about since end of July now, we are getting much more at ease at what is required. Because, you know, sometimes what happens is that when you leave an environment that you're very, very familiar with completely, and then you come back in, there's a little bit of tentative, fact-finding that takes place. But now I feel much more comfortable. But it has been a gradual process. The worry is, of course, how things develop. And but currently, as far as I'm aware, around the world, the dental practice, it's per se, has not been a source of an issue of infection being transmitted, as far as I'm aware, from all the evidence that I have read, and internationally.
Really good news. And Shilpa, what was your experience?
Yeah, initially, yes, almost like what Dr. Banerji said, yes, we were all apprehensive of what was going on. So yeah, we do recognize that this is a time filled with uncertainties for everyone, especially for our patients. But now there is there's like an increase in the number of cases in Bangalore especially. But also, we now have an evidence and information we did not have a few months ago. Okay, yeah. So we kind of reassured that by following our enhanced protocol, we are safe. But that doesn't mean just because we are open, doesn't mean we are back to normal. Today, now in September 2020, we're thinking of ways to fight against COVID-19, but still nobody seems sure what the future brings. So yeah.
And sorry to interrupt, but I would have to say, Ghazala, that from as a professional point of view, from looking at throughout my 35 years or so in practice, we've always been good at managing infection control, you know, through AIDS, through other, infectious diseases, other viruses, hepatitis, etc. We've always been, as a profession, very, very good at managing, and it's been quite an exception. And I say this, I know about UK, of course, but I can say, generally speaking, throughout the world, this is kind of reflected that the dental practice is quite one of the safest environments to be in, and we have been very good at mitigating risks with this. So I'm quite confident that gradually we will see a perhaps there might be a few new protocols, but by and large, I do feel that we are going towards a better enhanced service as time goes.
Yeah, and do you see, of course, there is a drop in the number of patients who are coming to you, but also one of the reasons would be that, it has impacted everyone. A lot of people have lost their jobs or their income salaries have been reduced. So as far as dental treatment is concerned, that would not be the priority. They would be spending whatever money they have on essentials. And it would be only if it was an emergency treatment that they would be going to a dentist. It would not be so much for, implants or aesthetic dentistry. So what has been your experience, Shilpa? First of all, I'll ask you in India about this.
Sure. So teeth have unfortunately not gotten any better during the past few months. Okay, so there's no escape from having bad teeth or toothache or.
The people are gritting their teeth all the time, so that would be great.
Yeah.
In the given
There is a lot to take care of, but as an aesthetic dentist, I can see nothing will stop patients from searching for aesthetic dental treatment, even more so now, maybe slowly now, because they have more time at hand, because, you know, they're mostly at home now. They have, they say, you know, convenience of time, if I may say so, and they're able to just come by whenever they can. They don't have this time restraint of, you know, having to come back from work and coming to see a dentist, which used to be the norm previously, and we used to work late in the evenings as well to be able to accommodate such office goers. But now people have time to spare. So in fact, I would say, yeah, I might actually be seeing more people interested in having some sort of cosmetic treatment that they've been postponing for a while.
That's because I thought it would be only when someone has a terrible toothache that they would be coming. Otherwise, they'll just try to postpone it once things become better. But you're giving us a completely different kind of.
So it therefore seems like Indian people have decided to live with COVID and stay beautiful at the same time. So.
Why not?
What more
I was going to say, just to add to that a little bit, I think my experience has been in the surgery where I do get a lot of referrals, and quite rightly, as you say, that certain patients are deferring the complex treatments till later. And just in addition to what Shilpa said, is what I'm finding it where I'm getting more and more deployed or being able to do is to actually sustain patients. In other words, for those of us dentists who will sort of recognize this, that we have in a complex restorative treatment plan, you have a stabilization phase. And so basically you're stabilizing the patient, and maybe they are not quite ready for the restorative outlay, for example, the implants, but you have a duty of care to actually maintain them at a certain level so that when they are able, they're able to invest in the original treatment that they wanted. So for example, I had a lot of patients that before lockdown were kind of lined up for complex graft procedures and implants, etc. And so now immediately following the lockdown, there was partly due to the accessibility and partly due to finance, they had a rethink. So I found that my practice, it went in towards more sort of dental work that was kind of aimed towards maintenance of a patient's status quo, so that they were reasonably healthy and functional while they are deciding upon the more complex treatment. And that's been my experience with here. And this is where the communication between remotely with a patient, as well as being able to deal with their immediate needs in order to maintain them, has been quite important. So that my treatment plans are now, when I go in, to maintain my patients with that bridge, temporary bridge for that bit longer, or that temporary crown for that bit longer, because they want to save up or have the more complex definitive work done later. So that's another aspect that I'm finding added to this. And interestingly, however, there is a gradual demand back, whether this is a sort of reflection on how generally people feel about themselves, because if you have been through a tough time, sometimes not having sort of a confidence in your smile affects your generally well-being. I think that has an effect on it. But of course, the emergency side there too. But I think it's a combination of all of that I'm finding that's happening right now.
But I always thought that there was a kind of a cultural difference also between the West and in India, where dental care was not really given so much of priority in India as it is done in the West. You don't really go for regular dental checkups or for hygiene reasons and polishing, cleaning and things like that. So that would be a difference, isn't it, Shilpa?
Yeah, that's what I thought till recently. And then when people started asking me for tooth whitening, or, you know, the unusual questions that you tend to get, something that's never been asked of me before. So when people say, oh, I think that small tooth there, it affects me, or that small space there affects me, and I get into my cosmetic dentist mode. Okay, up until now, I'm like the safe dentist who's just here to provide just the care that they need for them. for that point of time, and now I just don my cosmetic dentist mode hat on, and then I get into doing quite a lot of treatment these days. Having said that, there's also quite a lot of apprehension about whether these people who are on a particular insurance, if they might lose the insurance, because there's a lot of jobs that are being laid off. So while they're still on this insurance plan that they're on, can they make most of it? Is that probably why they're coming to see me now? I don't know. I mean, that's probably something that.
And do you think, both of you think that both UK and India are at different points of pandemic, and that is also impacting the dental practice in a different way?
I feel so. I feel that it seems from the UK that we are at different points and how we're also managing it. It seems that we are closer to this anticipated second surge than perhaps India is, just my general feeling, having read the press and so on. And so we're kind of having rather local lockdowns and a kind of an anticipation of how things are going to be at the second round, so to speak. So there is that aspect that I feel that the UK incidentally has had quite a, if I may say so, quite a high death rate from the virus, which has been publicized. So that has affected how the government and a lot of people have been dealing with it. So there is a difference between what we're seeing, which I think is worldwide too.
Mm-hmm. And in what way do you think you can, as dentists, you can enhance your practice? We've been hearing this has been the buzzword. Telemedicine has been the buzzword for a long period of time to cut down on the travel and the wait at the clinic and things like that. So it was an option, but now in the given scenario, it's no more an option. It is becoming more essential that you do online consultation as such. So what are your thoughts about telemedicine, Dr. Subir?
I agree with you very much. I found a sort of a general work change generally. For example, a lot of meetings are held online at the moment. So, and now what we're seeing in businesses in the UK, that they're rethinking this office strategy as to saying that now whether it would be better to shift from a office environment onto an online environment. Mm-hmm. And there has been this sort of trend where it was always in the background, but now it's become very much an option, and indeed a policy that a lot of businesses are following. With dentistry, it's interesting you mentioned telemedicine, because in teledentistry per se, there's very recently an article published in the BDJ where they did some work on looking at the satisfaction of patients for teledentistry. So if something was happening, a consultation was happening via if something was happening with the communication, the clinical communication with patients. So what I think that's going to be very well, definitely in my practice that is going to be implemented, is that a more efficient use of my time, where a lot of the online clinical exchange with the patients can take place, as well as, of course, the hands-on that we need to do when the patient is in the dental chair. So it's kind of made the interaction much more effective and efficient. And I think this is going to be the new norm, if I may say so, with dentistry in particular, with my experience, but I suspect in medicine too, where we actually have to rely on an online communication with our patients in a very confidential way, because we have to be very confident as clinicians with data protection and image transfers and so on, that these are not misused or they're not. And so the other sort of the regular modes of communication like email and WhatsApp is not secure enough. It has to be a very secure environment where both the patient and the clinician is confident of the data transfer and the confidentiality being maintained. And if that is there, then of course, as a clinician, you feel much more secure when you're actually dealing with your patient in this sort of, in a blended sort of way, where then you're much more efficient as when you're seeing them. And so I feel that teledentistry is, and medicine in particular, all forms, is going to be very much here. for the future.
So, Dr. Shilpa, as Dr. Subir said, for pre-treatment and post-treatment follow-ups, online consultation has become very essential. And you have the experience of using XpertOnline app. What has been your experience, and what are your thoughts on it? So, as Dr. Subir said, the confidentiality and how secure the data is important for the doctor as well as for the patient. So can you tell us a little bit about your experience?
Sure. I mean, it's a little unfortunate that it took a pandemic for us to appreciate something like XpertOnline. I mean, I've been a consultant on XpertOnline for a while now, but I don't think, to be very honest, I don't think I've made use of such an easy to access quality healthcare platform like XpertOnline as much as I did during the closure, during the lockdown period. So it did help me quite a lot, I must say. I might have been late to the party, but I'm definitely a fan of how much this, because of how much this has helped me. Because, it does definitely triage. It helps us triage now, because we now have this strict pathway of triaging patients. It helps me triage patients to minimize the number of visits they make to the practice, one thing. And also I find that this is one of the most efficient ways of communicating with patient, because I have, a chance to be able to call the patient or make an appointment with them, or the patient can make an appointment with me, maybe for like a video chat or something. And the discussions, essentially the discussions form a part of the clinical notes, and these are stored in a much more safer and secure manner in the database. So that's the assurance I have for having these conversations online over a platform like XpertOnline. So that definitely does make a difference for me. So yeah.
And
I was just going to say, sorry to interrupt. There's one other aspect I was going to say that makes a difference from my point of view also, is that, and I'm being very pragmatic here, because when we're consulting, of course, you're giving time, valuable clinical time. And it's important this to be monetized too. And if I sort of bring a practical point in here from a clinician's point of view, and where you're able to consult complete records, and you're able to consult CT scans, CBCT scans, or radiographs or reports, you're able to give quite substantial help to your patients, via the security. And therefore, you're able to monetize it too, because we are, after all, spending time compiling this, and that's very important, because it's not just a sort of, because sometimes when you're just having a telephone conversation, sometimes there's a element of value and worth to that. Whereas, when you can actually make a very good call on your reporting of what the clinical findings are and the diagnosis, it makes it a much more substantial service that you can offer your patients as well.
Yeah, that's from the doctor's point. And if you look at it from the patient's point of view also, the fact that the patient is paying fees for the consultation online, that patient also has the confidence that the doctor is taking his case seriously and, devoting time and giving him the right kind of advice. And of course, the monetization for the dentists and the doctors is very, very much important. Dr. Subir, you've been using our XpertOnline Pro. What has been your experience with that? You did briefly mention earlier about it. Yeah.
Yes, I did. And I think the main difference it made for me was to being able to offer the mentorship. In other words, being able to, I have, from the other side of my job is teaching, and I've had the good fortune of teaching around the world, and I do have students from around the world, and they often consult me on cases. And my students want to get in contact with me regarding cases. So it kind of offers me this, the pro version, the online pro version, offers me that opportunity to be able to communicate with students who have either studying at the time with me or are seeking essentially mentorship, and which I can then now do remotely very easily and securely, and with the knowledge that I'm able to have all the information. To give you an example, I run a diploma program where part of the program students have to present some clinical cases, and they were able to do that on my Pro app. So they were able to submit their files, all the requirements, all the radiographs, everything that I needed to see, the scans I needed to see, and I was able to spend some time looking at them. And then we had conducted the kind of conversation via the app using the material that was sent in. So it's allowed me to do a lot of mentorship for my students, as well as I have a referral practice.
I think
on that level.
Yeah. Okay. So the consultation with your associates and colleagues also is easier on.
Good.
Well, I think that quite a few questions have been coming up. So it's time that we take up some of the questions. There is Avisha Gopal who's asked, as a private practitioner, do you think COVID-19 will bring about any much needed reform to dentistry? I think
that's a very, very deep question. I shall immediately refer to Shilpa on that one, and then give me time to think.
What's that question again? Can I have the question again, please?
Maybe Shilpa can do a root canal on this question. As a practitioner, do you think COVID-19 will bring about any much needed reform to dentistry?
I mean, I don't think we've done things differently in terms of how we maintain the safety protocol in a practice. We've only just enhanced it. Okay, so we've only just reinforced what we used to do before. Having said that, this new emerging SARS-CoV-2 threat, it could become less pathogenic and more it might become more of a common infection in the worldwide population. It is predicted to persist in our population as a less virulent infection with milder symptoms. So it's just important to make informed clinical decisions and educate the public to prevent panic while promoting the health and well-being of our patients during these challenging times. So as practitioners, I suppose we should all just be prudent in continuing to update ourselves with useful online information as this outbreak continues. But apart from that, I think we'll all just adapt to the new normal. That's probably what.
It's always important in dentistry. Now we'll be much more vigilant, and there'll be protocols. And the other thing is that, as we discussed, that quite a bit of it would go online, so that we cut down on the multiple trips that the patients make to the dental clinic.
Yeah.
I think in my view, I think to answer the question is that we have to be very mindful of not becoming complacent in the importance of patient communication. And that's what's highlighted it for me, is that as COVID-19 has kind of brought us into the front, that you have to communicate with your patients, and you have to maintain a level of communication and not become complacent. That, just because you've been seeing a patient, I have a family practice, because I've been seeing my patients for the last 30 years sometimes. I often mention to my colleagues is that I've been very fortunate to see my patients, their children, and now their grandchildren treatment. And sometimes you get into this complacency that this sort of the family is completely devoted to the practice, and they are, but they do need assurances. So I think one thing that COVID-19 has taught is not to become complacent, to not underestimate the importance of patient communication. All my patients wanted to have felt the reassurance when they knew that I was communicating with them directly. And that was important from my point of view.
Yeah, thank you. There's Kanika Lata who's asking, what precautions are taken by dentists when patients visit you for physical checkup? What are the precautions?
In my practice, what we do, we use a double masking technique. We use an FFP2 mask. We use and then a surgical mask on top. We have a visor, a head coverage, a gown, a sterile gown, and an apron. And then, of course, gloves. All the patients are triaged before they come. If there's any aerosol generating procedure, then there is an hour-long gap between the next patient that arrives. But for examinations, of course, the aerosol generation is less. So the time in between appointments can be shortened slightly. All patients have a a pre-rinse before to reduce this, sort of seem to actually reduce the viral load in the mouth, generally speaking. And of course, my assistant is doing the same thing. And we do not have more than one patient in the waiting room, etc. That's how we kind of control. We basically control the environment that we're in. And then once the patient is gone, we disinfect the whole surgery before the next patient comes in. So that's the protocol we're using at the moment.
Yeah. What about you, Shilpa?
Sure. So, I mean, there's no difference in the way we manage the aerosol generating procedures and non-aerosol generating procedures at the moment. So it's more or less the same. So we all of us, my clinical assistant and I, we wear full enhanced PPE kits. So we have the mask, the N95s that we call the FFP3. Is it, Dr. Banerji?
Yeah.
FFP3, maybe? Yeah. So wear those and the full PPE kits.
Yeah.
So, and we also have a fallow time of about 20 minutes. This is a protocol not arisen from any particular evidence-based guidance. It's just what I followed from looking at what the UK dentists are following, really. And I also don't have any more than one patient in the practice. So we don't allow anybody to wait in the waiting room for now. And initially we used to take the body temperature, but apparently it's a little farcical, so I don't do that anymore. And hand washing and disinfection have become a standard now. Yeah. And I also have something called a low volume disinfectant fogger. So I use electrolyzed saline, which is also called as hypochlorous acid, which is considered to be about 200 times more powerful than bleach, but safe to drink. So we use this and we fog the whole place out between patients. And I also have a lot of, I have a UVC light that runs automatically at the end of each workday after everyone's left. And we also have a lot of, plenty of cross ventilation, which helps. So yes, pretty much a lot of things are taken care of.
In a way, it answers Ashwarya Joshi's question, who had asked how safe is it to visit a dentist right now. Listening to both of you, it is pretty safe. And there is Yash Ghazala, who is asking, what precautions should, as a patient, I take in order to create the safest environment possible for me and other patients and staff members of the clinic? What can the patient do who's coming in? That's his question.
The patients, I think there's a responsibility to let the practitioner know immediately if there's any symptoms. So if you're suffering from any symptoms, however mild, please do consult your clinician to make sure before you arrive. And I would also say that it's very difficult sometimes. When my patient comes in through the door, I have them do their hand gel. I have them put their personal belongings in a separate area. I have them wear a head cover and a gown over the top of the outside clothes and shoe covers. And this can be a little bit challenging. It doesn't look as fashionable as well. So this can be a little bit challenging for patients. But I think from the patient's point of view, to be a little bit aware that this has been done for a reason, and complying is quite important, and that this actually is to help everybody. So the reason for the time and why there is a time between and why we're doing this, there is a rationale behind it, and I guess to understand that it's actually in effect everybody's protection, including their own.
Yeah.
There's another question as for you, Dr. Banerji, as to what is your opinion about DIY dental kits in the UK?
Hate them. I personally hate. I think this is always a difficulty. I think I can see the desperation among patients, because there has been, in fact, in the news in the UK, there was news of someone who self-extracted a tooth during lockdown. And this is very sad for the profession. I think we as professionals should be able to protect and care for our patients adequately during this time. And I appreciate that this was a very unprecedented time. Could not be, and there, of course, we had emergency, and so there was a lot of confusion at the beginning. but I'm delighted to say that a lot of the confusion has settled, and there's a lot of confidence that has returned. So I do hope that this necessity for DIY dentistry or DIY dental medicaments, apart from those that are prescribed, of course, are not required. So I don't have a very high view of the DIY dentists, I have to say. I'll over to Shilpa as well for her.
Likewise, Dr. Banerji. So pandemic or not, that's not something anybody should really even think about. So yeah.
And someone is asking about about pediatric dentistry in these trying times. I suppose children sometimes need immediate attention.
Yes, I think it might quite interesting little. Very quick story, if I may. It's going to take a few minutes. Well, I had the 5-year-old come in. He was having some toothache. Actually, what it turned out to be was just interrupting tooth. And he was in the waiting room with his father. Both of them were gowned up with the whole thing. And I came down and from a distance, I said, look, this is what I look like. You have seen me before, okay? And in a moment, I'm going to slip into my spaceman suit. And so you're going to see me in a spaceman suit, but don't worry. So I went into my surgery and changed into all this thing that I described to you earlier on. And poor Aaron comes in through the door.
Floating into your clinic?
And poor Aaron came in, this 5-year-old took one look at me, and he did not want to let go of his father. And you know what? I don't blame him. He saw this man completely covered up from head to toe on this PPE. So this area of communication here now. So for children, I feel it's very important because they're seeing something that it's already a very stressful scenario for them coming in for this. And what I would say here, my take on this was that, of course, I've always followed in my practice the ethos that always get acquainted from the child. Don't see the child at the first visit in pain. Always encourage the parent to come in, introduce the dentist so that they're actually communicating when it's fun, when they're playing with the buttons and they're kind of coming to see almost, a dentist friend or dare I say dentist uncle or something like that. And so that the first meeting is not with pain. And so I think with pediatric dentistry, I think that if you have your patients, my patients have been quite long-term, they've been quite easier to adapt, but the new child patient with pain requires that much more care, that much more time. I would book more time in the surgery because there's that extra barrier to get across so that you can gain their confidence and trust if they're seeing you for pain.
And Dr. Shilpa, you do see a number of children, don't you?
I do, yes, yeah. So though I practice now in India, I've always been trained the same way Dr. Banerji has just explained in treating small children. So the main thing is about familiarizing yourself with the patient as well as the patient being comfortable with you. So we always talk to them first. I don't really wear my PPE straight away when I have to see a child patient. I maintain this distance, the social distance, and then try and talk to them first to see what's going on. And then once I know I've gained their confidence, I don my PPE kit, and most kids know the Toy Story and Buzz Lightyear. So I try and depict myself as Buzz Lightyear, saying up and away to the space, or we just use terms that they're familiar with, and then we try and enact, we try and get a little animated with them, and most times we get away with whatever we do.
Okay, thank you. There were a couple of questions where they're asking that they had to get their veneers done or some other treatment, and after having listened to both of you, I'm sure they can go ahead and visit their dentist, but taking all the precautions. So thank you so much, Dr. Subir Banerji and Dr. Shilpa Endla, for being with us today. And this has been really, really interesting and very insightful. I'm sure it's been very helpful to a lot of people who were able to join in. And I would like to thank all those who joined in for this session of Experts Matter. Thank you, take care, and be safe. Thanks.
Thank you very much. Thank you.